The true wealth of any nation is contingent upon the effective utilization of its human resources without exception. It is easy to leave the vulnerable behind because by their very nature and condition, they are unable to insist on their rights. One such vulnerable group is the mentally challenged and epileptics. What this means is that Ghana cannot claim to be maximizing the use of her human resources for growth and development once it is not doing much to ameliorate the unacceptable and avoidable conditions of the mentally ill and epileptics in society. Basic Needs Ghana, an NGO dedicated to the welfare of the mentally ill and epileptics, has committed itself over the years to ensuring that not only are the rights of this group protected, but the problems of its members are addressed so that they are mainstreamed into society to contribute to its developmental agenda.
Our motivation stems from the fact that as a development organization, we want everyone to participate in whatever affects them, and that we cannot continue to do things for people we claim need to be supported. They at least need to know what it means to get access to treatment and really be treated, to become productive, to let your voice be heard, and that whatever decision you make or wish to make, you contribute to such a decision and be heard by all. Even if probably majority may not go along with you, you have made your point.
For effective lobbying for government resources and policy change, Basic Needs saw the need to mobilize user groups of mentally ill and epileptics to assemble at the district and national levels. A 5-year strategy was subsequently rolled out, creating a 3-tiered democratic user movement. It is made up of 239 community self-help groups as the base, 38 district associations, and 1 national association. The self-help groups are made up of stabilized mentally ill, epileptics, and their caregivers.
Breaking barriers. Mental health.
This is a district association of self-help groups in a typical meeting. It is made up of elected executives of self-help groups in the district and serve as their mouthpiece. Among others, they communicate the concerns of their members to this higher body for redress.
The 17th of February, you call at clinic. Don't forget the date, 17th February.
On due date, they attend the quarterly outreach clinics supported by Basic Needs. Health practitioners say such clinics are making an impact.
They help us to reduce the relapsing rates within our catchment area, and also we are able to give our best out. We are able to educate the clients to know the importance of being on the medication.
Now we are able to move to the remotest places in Ghana. Formerly, we will only work at where the facility is, but Basic Needs is footing some of the bills to get into the remotest.
However, there are challenges.
We've been getting the medicine continuous, but now we've not been getting the medicine, so the people have not been coming to the meeting.
The most important support that we would like Basic Needs to give us is our office. We have a very small office, and we want them to provide us with a very large and spacious office that would enable us to give out our care to our clients. As a nurse, my heart bleeds to see that clients come in and because of lack of space and congestion, they move away, they go away.
Through its structures, the group makes efforts to address some of its challenges.
We've been able to solicit for funds from Heal the World Mission. They have been able to come to our aid by providing us, let's say, 400 Ghana cedis as a supplement for our, shortage drugs. Plans are also far advanced to reach our district chief executives, our sub-metro directors, to also come to our aid by providing us funds to purchase our shortage drugs.
What we have found is that it's good for them to have these social groups where they serve as the group collateral, call it social capital they have to access certain resources individually they would not have otherwise been able to access. For example, if we are encouraging them that they access support from district assemblies, it would not be wise to see individual mentally ill people going with their individual requests to the assemblies, because the first thing people may say is they have known you not to be well, and to see you walk up there knowing what our society is would be, this guy is not normal.
One of the most important advantages of the self-help group is the sense of belonging they feel on coming together. But for them, not until society, the major perpetrator of stigmatization, is educated to come off it, social exclusion will continue to depress them.
When I was younger, a similar stigma existed in Canada, and we've worked hard to overcome that.
Having now gotten a voice through the self-help groups, the mentally ill and epileptics decide to fight stigmatization head-on.
We are undergoing, advocacy program, schools, mosques, and churches, to tell them that if your children suffer for this very mental ill or epilepsy, don't just ignore the person. Bring the person to this very association. There's a cure for that.
Like it is an infectious, then our carers will first be affected.
By far, one of the strongest evidence yet that mental illness is treatable is Madam Doris Appiah-Dankwa. Having been off drugs since 2000, she now manages the Secretariat of the Government Statistician.
What helped me most was Isaiah 60 verse 15. God said, whereas where we were, no man passed through us. He promised me that he will make me an eternal excellency and a joy to many people. And he's done that. I'm a joy to many people. I've wept many tears. So when somebody talks about madness, I don't have stigma. Because I ask just one question, whose tears have you wiped? I have wiped tears. Whose tears have you wiped? So for me, I don't feel stigma.
Doris says what the mentally ill need is genuine help from society from a position of understanding, not pity.
All we're asking is put yourself in our shoes. If you are in my place, you got to finally hear medical school, and you got this frustration of dropping out of medical school through no fault of yours. What would you want someone to do for you? And do the same. That's all I'm asking. I don't think friendship is by force. I don't need anybody's friendship, because I'm a friend to myself and a friend to God. But not everybody can understand that you can be your own friend and be a friend of God. Those people need to be held.
She epitomizes the crucial role support from family and society plays in the recovery process.
Mental illness mainly is to do with behavioral change. And so if you get support from your family and from your friends and from your community, there's no way that you cannot live a normal life. There are times when I wanted to strip naked, my family will not let me go out like that. My brothers will hold me and bring me back home. And so for me, the whole society, especially the communities that we are in, if they accept us, we are on our way to recovery. And that's what I said, I got married properly. I have a daughter in National Motor School, Form 2. And I explained to my daughter what has happened to me in case somebody tells her, oh, Mami, I was them. She has no problem with her mother being mentally ill. I'm proud. She's proud of me as a mother. I'm proud of her as a daughter. My family is proud of me. My friends are proud of me, because they didn't expect me to do the things